This is a really exciting time in PKU with a new treatment coming out. Sepiapterin is an oral Phe-lowering medication just recently approved for PKU in individuals of all ages. So for individuals with PKU, historically, standard of care treatment has included a protein-restricted diet with low phenylalanine formula. And more recently, there have been two Phe-lowering medications available on the market. These previous two and the diet do not always sustainably work for everyone to keep their blood phenylalanine or Phe level within the target treatment range. And that target treatment range is less than 360 micromoles per liter. So sepiapterin will become the third FDA-approved Phe-lowering medication. The approval of it is exciting because it offers an additional Phe-lowering option, and it may be appropriate for some people who've not achieved their treatment goals with the other two available medications and/or with the PKU diet. So for general practitioners who are working with individuals with PKU, we absolutely want you to encourage those encourage individuals with PKU that you're seeing in your practice to come to PKU clinic, which sometimes is referred to as a metabolism or metabolic clinic. Even if someone has been away from clinic for many years, we always welcome people back so that they can be made aware of these new treatment options.
The added benefit, right now we have a drug called sepiapterin, which we've been utilizing for a long time under the brand name Kuvan. Sepiapterin provides an alternative treatment to this, hopefully helping patients with extremely diminished levels of phenylalanine hydroxylase, which is the enzyme affected in this disorder. It's thought that patients, even with null mutations or mutations which may be leaky, meaning there may be minimal to almost no enzyme, may be helped with this treatment so that the drug can help. It has a chaperone effect. It can help with the conformation of the enzyme which may be affected, so that those, again, with almost nil in terms of enzyme activity may actually see benefit from it in reducing their phenylalanine levels as compared to a drug like sepiapterin or Kuvan. It's hand in hand. So it's always been centered around diet, and then the pharmacologic management has been an adjunct to that, hopefully helping to liberalize diet. That's helped quite a number of people with the use of sepiapterin, and now with sepiapterin, the hope is to expand the number of patients who may be able to liberalize their diet and increase their protein intake, which is our goal for most of our patients, to have them live, a more normal life in terms of intake. Never be 100% protein unrestricted, but the hope is that we can liberalize it enough so that they're able to increase that intake.
Many individuals will still require a phenylalanine restricted diet alongside this therapy. However, sepiapterin does offer a Phe-lowering effect that could either allow individuals to liberalize their diet and eat more dietary phenylalanine and more dietary protein. And for some people, it may lower their phenylalanine level, blood phenylalanine level enough that they would go on to a diet that gave them all the dietary protein that they need from food and would allow them to come off of that phenylalanine restricted PKU formula. Anytime people on a restricted diet get to liberalize their protein intake, it's a huge win. So any liberalization may allow people to It may allow people to have larger portions of foods that are higher in protein within their respective restriction. It may allow people to include types of foods in their diet that they used to not be able to include. And then for some individuals, like I said, it will allow them additionally to decrease that amount of PKU formula that they take in. And the amount of PKU formula for some can be really challenging to keep up with and have that intended Phe lowering effect.
We're excited that there's another drug here on the horizon that uh, can help our patients live, more normal life and increase their protein intake. That's always exciting. I think the general providers need to be aware that there are treatments out there and that they should enlist the help of a biochemical geneticist to help with this. We work hand in hand with metabolic dietitians who are integral to the team and the management of these patients. And so just to know that there's, a new treatment out there that may help patients even further in terms of liberalizing their protein intake is going to be important.